Gout is one of the oldest known diseases in human history, yet it continues to affect millions of people around the world today. Often called the disease of kings because it was historically associated with wealthy individuals who consumed large amounts of rich foods and alcohol, gout is now recognized as a common form of inflammatory arthritis that can affect anyone. Gout occurs when excessive amounts of uric acid accumulate in the bloodstream. Normally, uric acid is dissolved in the blood and removed through the kidneys. However, when the body produces too much uric acid or fails to eliminate enough of it, tiny needle-shaped crystals can form and deposit inside joints and surrounding tissues. These crystals trigger intense inflammation, causing sudden attacks of severe pain, redness, swelling, and warmth. The most commonly affected joint is the big toe, although gout can also occur in the ankles, knees, wrists, fingers, and elbows. Many people describe a gout attack as one of the most painful experiences they have ever endured. Some patients report that even the weight of a bedsheet touching the affected joint can be unbearable. What makes gout particularly dangerous is that it often develops silently over many years before symptoms appear. Elevated uric acid levels may be present long before the first attack occurs. The good news is that gout is both preventable and manageable when detected early. Understanding how it develops is the first step toward protecting your joints and maintaining long-term health. If you want to protect your joints and avoid future pain, stay with us until the end of this video. To understand gout, we must first understand uric acid. Uric acid is a natural waste product created when the body breaks down substances called purines. Purines are found naturally within our cells and in many foods we consume every day. Under normal circumstances, uric acid serves no harmful purpose. It is simply filtered by the kidneys and eliminated through urine. Problems arise when the balance between production and elimination becomes disrupted. Think of uric acid like garbage in a city. As long as waste collection services operate efficiently, the city remains clean. But when garbage accumulates faster than it can be removed, problems quickly develop. Several factors can increase uric acid levels: eating excessive purine-rich foods, drinking alcohol frequently, and consuming sugary beverages. Obesity, kidney dysfunction, certain medications, and genetic predisposition also play significant roles in how your body manages this waste. When uric acid concentrations exceed normal levels, crystals begin to form. These crystals are microscopic at first, often causing no symptoms. Over time, however, they accumulate within joints and tissues. Not everyone with high uric acid develops gout immediately. Some individuals may have elevated levels for years without symptoms. Nevertheless, persistent hyperuricemia significantly increases the risk of future attacks. Regular health screenings can help identify elevated uric acid levels before joint damage occurs. Early intervention often prevents years of pain and disability. Understanding uric acid is essential because controlling it remains the cornerstone of gout prevention and treatment. Have you ever checked your uric acid level? Let us know in the comments below. The main causes of gout. Many people mistakenly believe gout is caused only by eating too much meat. While diet plays an important role, the reality is far more complex. The causes of gout generally fall into two major categories: excessive uric acid production and inadequate uric acid elimination. Genetics plays a significant role. If close family members have gout, your risk increases substantially. Certain inherited traits can affect how efficiently your kidneys process uric acid. Dietary habits are another major contributor. Foods particularly high in purines include organ meats, red meat, shellfish, sardines, anchovies, and certain seafood. Alcohol, especially beer and spirits, significantly raises gout risk. Alcohol interferes with the kidney's ability to remove uric acid while simultaneously increasing production. Sugary beverages containing high fructose corn syrup are also problematic. Fructose metabolism generates additional uric acid and contributes to metabolic dysfunction. Obesity increases gout risk because excess body fat promotes inflammation and increases uric acid production. Certain medical conditions contribute as well: high blood pressure, diabetes, kidney disease, metabolic syndrome, heart disease. Some medications may elevate uric acid levels, including certain diuretics used to treat hypertension. In many cases, gout results from multiple factors working together rather than a single cause. Understanding these risk factors allows individuals to make informed lifestyle changes before symptoms develop. affected area becomes red, swollen, hot, and extremely sensitive. Why does this happen? When uric acid crystals accumulate, the immune system eventually identifies them as a threat. White blood cells rush into the joint and release inflammatory chemicals. This immune response is what creates the intense symptoms associated with gout. Within hours, the pain may become severe enough to limit walking, standing, or even wearing shoes. Symptoms often include severe joint pain, swelling, redness, warmth, limited movement, and extreme tenderness. The first attack typically lasts several days, although some episodes may continue for 1 to 2 weeks. Interestingly, symptoms often disappear completely after the attack resolves, leading some individuals to believe the problem has gone away. Unfortunately, without proper treatment, uric acid crystals continue accumulating. Future attacks often become more frequent, more painful, and involve multiple joints. Repeated inflammation can eventually damage arteries, bone, tendons, and surrounding tissues. This is why every gout attack should be viewed as a warning signal rather than an isolated event. Call to action. If you've ever experienced sudden joint pain, consult a healthcare professional and have your uric acid levels checked. Who is most at risk for gout? Gout does not affect everyone equally. Some people are naturally more vulnerable because of genetics, lifestyle, age, body weight, and existing health conditions. Men are more likely to develop gout than women, especially during youth age. However, after menopause, women's risk increases because hormonal changes can affect uric acid control. People with a family history of gout also face higher risk. Parents, siblings, or close relatives have experienced gout. Your body may have inherited a tendency to produce more uric acid or remove it less efficiently. Body weight is another major factor. When someone is overweight or obese, the body often produces more uric acid. Kidneys may struggle to remove it effectively. This creates the perfect environment for uric acid crystals to form. People with high blood pressure, diabetes, kidney disease, heart disease, and metabolic syndrome are also more likely to develop gout. These conditions often affect circulation, kidney function, and inflammation levels in the body. Certain medications, especially some diuretics used to treat high blood pressure, can also raise uric acid levels. But risk is not mere destiny. Even if someone has several risk factors, gout can often be prevented or controlled through early awareness, regular testing, healthy eating, weight management, hydration, and medical guidance. The most dangerous thing is ignoring the risk until the first painful attack occurs. If you have gout in your family, do not wait. Start prevention today. Foods that increase uric acid. Food is not the only cause of gout, but it plays a very important role. Certain foods contain high levels of purines. When the body breaks down purines, uric acid is produced. If too much uric acid builds up, crystals may form inside the joints. The foods most commonly linked to gout include organ meats such as liver, kidney, and heart. These foods are extremely high in purines and can quickly raise uric acid levels. Red meats such as beef, lamb, pork, and processed meats should also be limited. They may not need to be completely removed for everyone, but frequent large portions can increase risk. Some seafood can also trigger gout, especially shellfish, sardines, anchovies, mussels, scallops, and certain oily fish. Alcohol is one of the strongest dietary triggers. Beer is especially problematic because it contains purines and also interferes with the kidney's ability to remove uric acid. Sugary drinks are another hidden danger. Soft drinks, bottled sweet tea, energy drinks, and beverages containing high fructose corn syrup can increase uric acid production. Many people focus only on meat and forget about sugar, but sweet drinks can silently contribute to gout, weight gain, insulin resistance, and inflammation. The goal is not healing. The goal is balance. People at risk for gout should reduce high purine foods, avoid heavy alcohol use, limit sugar, and choose a more balanced eating plan. Check your daily drinks. Sometimes gout prevention begins with removing just one sugar drink. Vegetables should become the foundation of daily meals. Leafy greens, carrots, cucumbers, tomatoes, bell peppers, broccoli, and other colorful vegetables provide vitamins, minerals, antioxidants, and fiber. Whole grains such as oats, brown rice, quinoa, and whole wheat products can support stable blood sugar and healthy digestion. Low-fat dairy products such as yogurt and milk may be helpful for some people with gout because they provide protein without high purine drink alcohol should be especially careful because alcohol can dehydrate the body and reduce uric acid elimination. Sugary drinks should not be used as hydration. Soft drinks, sweet tea, and energy drinks may worsen uric acid levels instead of helping. Water, unsweetened herbal tea, and low-sugar beverages are better choices. However, people with kidney disease, heart failure, or fluid restrictions should ask their doctor how much fluid is safe. Hydration is not a cure for gout, but it is a daily habit that supports prevention and recovery. Before reaching for a sweet drink, choose water first. Your joints and kidneys will thank you. Weight management and gout prevention. Body weight has a direct relationship with gout risk. When the body carries excess fat, it often produces more uric acid. At the same time, the kidneys may become less efficient at moving them. This creates a cycle of high uric acid, inflammation, and repeated gout attacks. Weight management can reduce pressure on joints, improve insulin sensitivity, support blood pressure, and help lower uric acid levels. But there is an important warning. Rapid weight loss can trigger gout attacks. Crash diets, fasting, extreme low-carbohydrate diets, and sudden severe calorie restriction may increase uric acid temporarily. This can make gout worse instead of better. The safest approach is gradual, sustainable weight loss. A healthy plan includes balanced meals, enough protein, vegetables, whole grains, healthy fats, regular movement, and proper hydration. Exercise should be gentle, especially for people with joint pain. Walking, swimming, cycling, stretching, and light resistance training are good. During an active gout attack, painful joints should be rested. Exercise can resume once pain and swelling improve. The goal is not to become thin overnight. The goal is to reduce inflammation, improve metabolism, and protect the joints at the top. Even a modest improvement in weight can bring meaningful health benefits. Call to action. Do not punish your body with extreme diets. Heal it with consistent, healthy habits. A proper diagnosis is important because gout can look similar to other joint diseases, including infection, rheumatoid arthritis, and other types of inflammatory arthritis. Doctors usually begin by asking about symptoms. They may ask for the pain symptoms, which joint is affected, how severe the swelling is, and whether similar attacks have happened before. A blood test can measure uric acid levels. High uric acid supports the diagnosis, but it does not predict gout by itself. Some people have high uric acid without gout, and some people may have normal uric acid during an active attack. For most accurate tests, joint analysis. A doctor may remove a small amount of fluid from the swelling and examine it under a microscope. If urate crystals are found, gout is confirmed. Imaging tests are also used. Ultrasound, X-rays, or low-energy CT scans can sometimes detect crystal deposits or joint damage. Diagnosis is not only about naming the disease, it also helps determine the stage of gout and the best treatment plan. People with frequent attacks, kidney disease, tophi, or joint damage may need long-term uric acid lowering therapy. Self-diagnosis can be risky. Treating gout incorrectly may allow crystals to keep accumulating and damaging the joints. If you suspect gout, do not guess. Get tested and receive proper medical guidance. Treating a gout attack. When a gout attack begins, the first goal is to reduce pain and inflammation as quickly and safely as possible. Doctors may prescribe anti-inflammatory medicines such as NSAIDs, colchicine, and corticosteroids. The right choice depends on the person's age, kidney function, stomach health, heart condition, blood pressure, and other medications. This is why gout treatment should be guided by a healthcare professional. During an attack, resting the affected joint is very important. If the gout is in the foot or ankle, avoid walking too much. Elevating the joint can help reduce swelling. Some people benefit from applying ice wrapped in a cloth for short periods. Ice should never be placed directly on the skin. Drinking enough water may help support kidney function, but water alone cannot stop an active gout attack. Many people make the mistake of taking random painkillers or waiting until the pain becomes unbearable. Early treatment usually works better than just Another mistake is stopping long-term uric acid medication during a flare. attacks and avoid silent joint damage. While lifestyle changes like diet, hydration, and weight control are incredibly helpful, they are often insufficient for those with current and severe conditions. Urate lowering medications are the cornerstone of effective management, working to reduce the absolute levels of uric acid in the blood. Regular follow-ups with your doctor are crucial to monitoring progress and ensure that uric acid levels stay within a healthy range. Combining your prescribed medical treatment with a healthy lifestyle offers the best results for long-term health and mobility. Long-term medical treatment after gout. After someone has gout, long-term care becomes extremely important. Pain medicines can reduce inflammation during attacks, but they do not remove the uric acid crystals already stored in the blood. For people with frequent attacks, sulfide, kidney stones, or organ damage, doctors may prescribe urate lowering medication. These medicines help reduce uric acid levels over time. Common urate lowering medications include allopurinol and fluvoxamine. Other medicines may help the body remove more uric acid through urine, depending on kidney function and the patient's condition. The key is consistency. These medications often need to be taken every day, even when there is no pain. Many people stop treatment when symptoms disappear. This is a major mistake. Gout pain may go away temporarily, but crystals can remain in the joints and continue causing damage silently. When uric acid levels are lowered gradually and maintained at a healthy target, crystals can slowly dissolve. Over time, gout attacks may become less frequent and less severe. Doctors may monitor uric acid levels through blood tests and adjust medication doses carefully. Lifestyle changes are still important, but for many patients, lifestyle alone is not enough once gout becomes recurrent or severe. The best results usually come from combining medical treatment, diet, hydration, weight control, and regular follow-up. Call to action. If your doctor gives you long-term gout medicine, take it seriously. Prevention happens every day, not only during pain. Complications of untreated gout. Untreated gout can become much more serious than occasional joint pain. At first, attacks may happen once in a while, but over time, they can become more frequent, last longer, and affect more joints. Repeated inflammation can damage cartilage and bone. This may cause chronic pain, stiffness, deformity, and reduced mobility. One major complication is the development of tones. Tones are lumps of uric acid crystals that form under the skin, often around the fingers, toes, elbows, ears, and Achilles tendons. Tones can become large, painful, and sticky. In severe cases, they may damage joints, tendons, and skin. Gout can also result in kidney stones. When uric acid builds up, crystals may form in the urinary tract, causing severe pain and urinary problems. People with gout often have other health issues, such as high blood pressure, kidney disease, obesity, diabetes, and heart disease. This does not mean gout always causes these conditions, but they often occur together and should be managed carefully. The most dangerous belief is thinking, pain is gone, so I am cured. Gout is a crystal accumulation disease. Pain may disappear between attacks, but the underlying problem may continue silently. Early treatment helps prevent permanent damage. Do not wait until gout changes the shape of your joints. Take action before complications begin.
Gout prevention and recovery require a complete plan, not a single solution. First, know your uric acid level. Regular blood tests can help detect risk before severe attacks occur. Second, improve your diet. Reduce organ meats, large portions of red meat, certain seafood, alcohol, sugary drinks, and highly processed foods. Add more vegetables, whole grains, fruits, low-fat dairy, and balanced protein. Third, drink enough water every day. Hydration supports the kidneys and helps the body eliminate waste. Fourth, manage body weight slowly and safely. Avoid fasting, crash diets, and rapid weight loss because they may trigger gout. Fifth, stay active. Gentle exercise supports circulation, metabolism, weight control, and joint health. Walking, swimming, stretching, cycling, and light strength training can be excellent choices. Sixth, control-related conditions such as high blood pressure, diabetes, kidney disease, and cholesterol problems. Seventh, follow medical treatment if gout has already developed. Do not rely only on home remedies. Pain relief is helpful, but long-term uric acid control may be necessary to prevent future damage. Finally, build a lifestyle that protects your joints every day. Gout is painful, but it is not hopeless. With knowledge, prevention, medical care, and consistent habits, many people can reduce attacks and live healthier, more active lives. Final call to action. If this video helped you understand gout, like, subscribe, and share it with someone who needs this information. Prevention starts with awareness, and awareness